Good morning, prospective listeners and my followers, most likely some of my students. Today, I would like to talk an interesting topic. It has been a while. I see something on my YouTube channel, and I decide that for today, I would like to break that jinx of preventing me not to see something. And I have been thinking of what should I see. What should I say? I think some days ago I request for a recommendation from people on the topic I need to talk about, and so many topics has been presented to me, and though I haven't selected anyone from there, but I feel let me talk or give a talk on the anticipated book that I started writing in 2018. If you can remember, or if you have been following me, I published my first book in 2015 with the title Synopsis of Dental Instrumentation and Equipment. For now, the book title I'm writing or working on is Compendium of Oral Anatomy and Physiology. Under this compendium, we'll discuss about anatomical structures in the mouth, the physiology of oral structures, the embryology of oral structures, and the histology of oral structures. This book for now has 25 chapters, in which these chapters has been divided into 8 sections. Each of these sections is having similar chapters brought together for easy comprehension. Um, the first chapter of the book is an introduction. This introductory part will serve as a guide to introduce the book, to give us a hint of what the book will contain. Under this, we're able to explain what oral is with the different synonyms attached to it, what physiology means, what is the meaning of anatomy, what is the meaning of histology, what is the meaning of embryology. We have also talked about what is the meaning of oral anatomy, what is the meaning of oral embryology, what is the meaning of oral histology, what is the meaning of oral physiology. We have also talked about what is the meaning of dental anatomy and physiology altogether. This gives a guide on the title of the book. And the second chapter is termed as terms used in dentistry. Under these chapters, I was able to talk about the different terminologies we use in the dentistry. Uh, any profession or any medical profession has some terms that are associated with that profession, which any professional in that profession must have a clear understanding of those terminologies because those are what will be used during the course of practice. We have talked about structures like mesial, distal, palatal, occlusal, sublingual ridge, cusp, mamelon, incisal edge. All these things we have discussed them in an advanced level, such that anybody that goes through this terminology and understand them clearly will easily understand the practice of dentistry. And secondly, or thirdly, we have discussed about cells and tissue. You remember that in your biology, where it has talked about level of organization of human being, which this level of organization starts from the anatomical being, from there to the cells, from there to the tissue, from tissue to organ, from organ to system, and from system to human being. So we like to talk about these tissues and cells because they are what form oral structures. For instance, now the enamel, dentine, and cementum, all these tissues are formed by some cells. Ameloblast forms the enamel, cementoblast forms the cementum, and odontoblast forms the dentine. So the tissues also, we discuss them at general so that we can clearly understand them in specific terms when we begin to discuss them. Then the fourth chapter of this book, which is under the second section, is the face, the nasal, and the oral cavity. under which we describe what is a face, what is the nasal cavity, and what is the oral cavity as a whole, so that we can have a clear understanding of what is the stomodium. That's the primitive mouth. How is it formed? Its level of development. At what level or at what age is it that the development of face starts in the embryo? All we have discussed under this chapter. Then the fifth chapter is tooth development. Under this, we discuss during the course of development of the face and the oral cavity, at what time, at what age does the teeth begin to develop? What are the embryological tissues that lead to the formation of the teeth? This we have discussed under this chapter. And under the third section of the book is we talk about the enamel, which is the hardest part of the teeth. Under it, we talk about how it is being formed, we talk about its functions, and so much more. We have also talked about dentine on the seventh chapter of the book. Talk about the definition of dentine, talk about the function of dentine, talk about the formation of the dentine, talk about what is dentine, what are the functions of the dentine, how is dentine being formed. We have talked about this under the seventh chapter. While on the eighth chapter, we talk about the cementum. How is the cementum formed? What are the cells that form the cementum? After the formation of the cementum, what are the cells that brings about repair in the case of damage of the cementum? This we have discussed under the eighth chapter. While on the ninth chapter, we talk about the pulp, which is seen as a main vital part of the tooth. And we have discussed about the development, the cells that brings about development, how does it regenerate after it has been damaged. So many things that has to do with the pulp has been discussed under this chapter. While the 10th chapter is alveolar, which is also a part of the supporting structure of the teeth, the bone that houses the tooth. We have talked about it on different perspectives. And the 11th chapter is the periodontal ligament that we have discussed at length. Yeah, what forms the periodontal ligament? How is it formed? If damaged, how does it repair? So many things that has to do with this we have discussed. While on the fourth section, we have three chapters, which are the oral mucosa, the salivary glands, and the saliva, and the fourth one is oral soft tissues. Under the oral mucosa, we have discussed about what is oral mucosa. All these three things are part of the soft tissues. The oral mucosa lines the internal walls of the oral cavity. We have discussed it at length. How does it form? What is the form of the epithelium that forms this oral mucosa? And the 11th chapter, which is saliva and the salivary gland, we have discussed it at length. We have talked about what is the saliva, what are the cells that form saliva, what is the function of the saliva, and how is saliva formed. We have also talked about the salivary glands. What is salivary gland? And what are the different forms of the salivary gland, the major and the minor salivary gland? So many students find it difficult to understand the minor salivary gland. Some students might say they are not aware even of the existence of the minor salivary gland. That we have discussed at broad length in this book. And we went further to talk about sensation of thirst. Under this, we have talked about so many things. We also talk about the soft tissues of the oral cavity, other soft tissues. We talk about the uvula, we talk about the tonsils, we talk about the tongue. You know, on the tongue, there are so many things on the tongue. Even though the previous chapter is the saliva, we cannot talk about the formation of the saliva skipping the tongue because it has a major role to play. Because saliva and taste goes together, and the tongue is what houses the formation of taste, even though the palate also has its own level of contribution. Yeah, we have discussed the soft tissues. So we have discussed so many soft tissues that are found in the oral cavity, the floor of the mouth, the lips, the frenum. All this has been discussed under the chapter. And we have also talked about the mastication and deglutition. That is how you chew food and how you swallow foods. We talk about the different stages involved in mastication and the different stages involved in deglutition. These all have been discussed in the 15th chapter, which is part of the section 5 of the book. And we have talked about the tongue in more advanced way here and the test formation of test in the 16th chapter. We have also talked about dental deposits, which, sorry, in the initial chapter, I said, in the initial talk, I said we have talked about the tongue. No, the tongue, it has been discussed properly on the 16th chapter, which we discussed the tongue and the test, formation of the test under this chapter. And the 17th chapter, we talk about dental deposits, the intrinsic deposit, the extrinsic. We have also talked about extrinsic and the intrinsic stain under this chapter. You know, under dental deposit, we have two forms of deposit. We have the hard deposit and the soft deposit. The hard deposit is the calculus, which we have the subgingival calculus and the supragingival calculus, while the soft deposit are three in forms. We have the acquired pellicle, we have the dental plaque, we have material alba, and we have food debris. All these have been discussed under the 17th chapter of the book. And on the 18th chapter, we talked about tooth nomenclature. Yeah, that is naming of the teeth has been discussed here. We have dentition here, which has been discussed in the 22nd chapter of the book. But here under tooth nomenclature, we're able to talk about description of the teeth, the different forms of teeth we have. And on the 6th section, we talk about the skull under the 19th chapter and the cranium. What is a skull? We are talking about dentistry here. Talking about dentistry will not be complete without talking about the skull and the cranium. So we have discussed on the cranium and the skull. We have discussed the different parts that forms the skull. And we have talked about the cranial nerve under the 20th chapter of the book. You know, we have 12 cranial nerves that are all found on the head. So we discuss them and talk about them in an advanced level so that as dental student, we will know what is all about these cranial nerves, what are their roles and their forms. Remember, we have the motor and the sensory nerves under the 12 cranial nerve. All this we have discussed under this chapter because we cannot just go straight forward to discussing about those that have more role to play on the field. We discuss them all at an advanced level so that student can easily understand those that play a major role on the field. That also has been discussed under the 20th chapter. On the 21st chapter, we have discussed about Temporomandibular Joint, TMG. Temporal bone has its own role and the mandibular bone has its own role. So when they come together, they form the TMG. We see this as the only freely movable joint in the on the head altogether. So we have talked about them, and we talked about it in an extensive level so that dental student will clearly understand the way of functioning of this TMG. And on the 22nd chapter of the book, we have talked about dentition. You know, we have some scholars says we have two types of dentition, while some say we have three types of dentition. So we have talked about dentition under the three types: the primary dentition, the mixed dentition, and the permanent dentition. All this has been discussed, and on the 23rd chapter of the book, that has discussed that discuss on the numbering system in oral anatomy. Yeah, we have talked about dentition. We know we have, and also we have talked about tooth nomenclature. So we know we have incisors, canine, molars, and premolars as type of teeth. So understanding this is not enough. So in clinical practice, we have different ways that these teeth are being numbered. So that wherever you see a particular number, you will know that, okay, we are talking about molar, or we are talking about lateral molar. We are talking about upper molar left or lower molar left. So when you go through this chapter, the numbering system, you will clearly understand the three major numbering system that are there in dentistry: the FDI, universal system, and the palmar notation. All this has been discussed under chapter 23 of the book. And on the chapter 24 of the book, we have discussed about functional occlusion and malocclusion. Let's understand what is occlusion. Occlusion is significant in oral anatomy. So we have discussed essentially the functional occlusion so that we will understand where there is an effect in occlusion that will alter the normal functioning of the oral cavity, or an effect in occlusion that has been formed leading to deformation in the oral anatomy. So we'll understand this in different respect. Also under this, we have talked about the angles classification of malocclusion, and we have talked about the overbite, overject, underbite. All these things are significant, How do we know that this is a normal occlusion, and how do we know that this is not a normal occlusion? These all have been discussed under chapter 24 of the book. And the last chapter of the book, which is under section 8, is abnormalities of dental and related structures. Very interesting. Why we talk about finishing this book with this important chapter is that we have talked about oral anatomy, we have talked about oral physiology. Then let's know what are the challenges that might affect the development of the tooth. What are the challenges that will lead to an abnormality in the normal expectation of oral structures? This we have discussed. We have discussed about hereditary abnormalities. We have also talked about congenital abnormalities. We have talked about things like, also we have talked about physiological related challenges of the tooth. We have talked about things like erosion, abrasion, affraction. We have talked about cleft left, cleft palate, amelogenesis imperfecta, dentinogenesis imperfecta. We have talked about anodentia. Here, all the three classification of anodentia has been discussed under this chapter. So you will find this book very interesting, very interesting. I hope you will be waiting to see. If you have any suggestion, any recommendation that you feel it will be significant in this book. Out of these 25 chapters I have mentioned, if you think there is a particular chapter that will be of interest to student and professional, please you can just comment on it so that I can look through it and see how important it is to us, so that we can know how to come up with it as part of our book. Just like I said, the target audience for this book will be students in dentistry, will be student studying dental therapy, will be student studying dental technology, will be student studying dental nursing, will be student studying dental surgery technology. Now, the initial dental surgery technician. So you'll find this book very interesting. Thank you very much for listening, and thank you for giving your time. I remain Ali Khalid. Thank you very much.